Okay, what I want to do by way of introduction is tell you how I got to be sharing this session with Sarah, because I think there's something quite interesting about the process. The organisers of today's event, one of the organisers, or a person who works for the company of which Pavilion Publishing is a part, contacted me less than 4 weeks ago and said, "Oh, Stuart, you're the lead director for mental health services in Wales, and we're organising a conference on the 9th of May. And I said, "Yeah, we haven't talked to you about it." And I said, "No, I spotted that. And you probably won't be surprised to hear that I was already committed to a lot of previously arranged appointments." Sarah, when she heard about it, because I told her, felt it was actually very important for local government to feature at this event as part of the landscape for mental health services in Wales, and agreed to share the opening session with me. She gave up 15 minutes of her time. And in a way, what that confirms is that the NHS, Welsh Government and local government share responsibility for mental health services. And I tell you this, not to embarrass anybody, but actually to show that actions are much more important than words. Shared responsibility is actually meaningless without the action to back it up. So thank you very much, Sarah. And that's the kind of theme of what I want to say to you this morning. Actions speak louder than words, whilst words are important symbols too. And that it's a developing landscape. It's a really beautiful landscape as well when you look at it. And it's actually one that I think could get even more vibrant, even more healthy with the implementation of the mental health measure. Because what the measure does, it requires me, as somebody who's involved in providing services, and those of you, others of you around this room who are involved in providing services, to act differently and act in the interests of people who are on the receiving end of services and their carers. And that's a real challenge to us all. So what I want to do is reaffirm we're in this together. And not just because it feels better to kind of be doing things with other people, but because if we were to return to doing things on our own, if the health service was just getting on and doing its own thing, if local government was getting on and doing its own thing, if voluntary organisations were just getting on and doing their own thing, we'd actually be getting it wrong. It is as serious as that, and we used to get it wrong. I've co-chaired two what I think have been really important programmes of work, and my co-chair was Mary Burrows, and Mary is Chief Executive of the Betsy Cadwallader University Health Board in North Wales. And what we did, we saw there was a review of mental health services in Wales that I think we published in 2006-07. And then following that, Mary and I co-chaired the Mental Health Programme Board, which is probably the grandparent or maybe a kind of second cousin to the partnership board that is emerging through the strategy. And I think both of those pieces of work were actually better as a result of our joint leadership. Because what we did was illustrate that neither the NHS or local government has the answers on our own. And Sarah said as much the same in her view about we're all in this together. We don't have the answers on our own, and indeed, we don't have the answers without a third sector contribution. And then most importantly, we don't have the answers without the contribution of service users and carers. So as we are in it together, I want to say just a little about integrated services, and you'll have seen that that kind of features in the one of the chapters of the strategy. I sometimes talk about being accused of being passionate about integration, and sometimes it does feel like it's an accusation that people put at me. But I do believe that actually integration is a critical part of the future landscape, because what it does, it forces us to share responsibility. It prevents blame being dumped on each other, because that's the history, and particularly between the NHS and local government. And where there is a pooling of resources, both money and staff, it prevents fighting over those resources. Because if they don't belong to anybody, or if they belong to a joint body, then the focus shifts from who's going to pay to how can we deliver better services and improve the outcomes for people who are on the receiving end, which is actually a much more healthy conversation to be having rather than who's going to pay for this. Therefore, integration, when I'm accused of kind of being too passionate about it, is actually only a means to an end. Integration isn't the end at all. The end is better outcomes, and actually that means better experiences for people. I believe that integrated services have three crucial characteristics. And just kind of stay with me on this. It's not too complicated, but I think it's really important. The key three characteristics are: there's got to be a single manager, there's got to be a single budget, and there's got to be a single information system. And you're sitting there thinking, well, I've got none of those. And sometimes what you have to do is start by knowing that that's where you're going to end up, and you work towards it. I've already mentioned the impact of a single budget or a pooled budget. It refocuses the attention on what we can achieve together rather than fighting over who pays. If you're struggling with this, all you need to do, if you're involved in providing services, or indeed if you've been involved in receiving services, is remind yourself about the last discussion that you had about somebody, and that somebody might have been you, who is eligible for continuing healthcare funding and has started to improve and possibly become ineligible. If you're in the NHS, in the past, what that was defined and described, and often still is, as an opportunity for savings, because the NHS doesn't have that responsibility, may not have that responsibility when that person is no longer eligible. If you're in local government, it can be seen as another burden, another financial burden you've got to deal with, and at worst can be described as cost shunting. And actually cost shunting can only lead to a fight, which is a huge waste of energy and time. So that's a single pooled budget is a really important step in ensuring that all of the energy in an integrated service is focused on doing the best by the people who are receiving services. A single manager makes it clear who is responsible. You don't have to think, oh, well, is it the NHS manager I've got to talk to, or is it the local authority manager I've got to talk to? If you've got one manager, that's the person you talk to. Highlights who's responsible, and highlights that the need is for good management rather than any particular professional background. And that can be a challenge. I've been a nurse all my life. I'm quoting people. I've been a nurse all my life, I've been a social worker all my life. It is only nurses or social workers who can manage me because they understand me. Rubbish. That is not true. I am currently managed by somebody who hasn't got a social work background. She happens to be my managing director, and actually she does a fine job because she's a good manager. And she allows me to grow, and that's the sign of a good manager. A single information system is a lot more tricky. But if you get there, what it ensures is there's no dispute about sharing information between those workers who actually share responsibility for either offering or providing a service. And I do know that we're not there yet. And the best thing to do when you're developing a single information system is you keep people who are into technology out of it, because they will find a reason not to do it. What you've got to do is strive towards it, and then invite people who are into technology to help you achieve it. Not ask them if it's possible, or ask them if it's achievable. You tell them. Okay. The draft strategy, a really important document, and I just want to quote as a kind of confirmation of what I've already said from the Minister's words, Leslie Griffiths' words in the foreword to the draft strategy. No single organisation, agency or sector alone can transform mental health in Wales. That is undoubtedly true. But if we assume it's agencies, organisations and sectors who'll do the trick, we'll have failed again. Because without properly involving users and carers who might not be part of any agency, any organisations, or see themselves as part of a sector, there'll still be a great gaping hole in our aspirations to give people real control over their own lives and over their own recovery. Of course, what this will mean is that we've actually got to listen to people very differently. And a bit like kind of what I was saying about actions speak louder than words, active listening actually means you act on what you hear. You do something about what you've heard, and on many occasions in this kind of work, those of us who are in the business of providing services, it means that we'll be taking corrective action to remedy somebody's poor experiences. Somebody tells you what you've done has been really unhelpful, do it differently. It isn't difficult. You simply have to, you might have to use different words. You might be being told that you've got to behave differently, not to be offensive, not to be aggressive, not to be unhelpful. If somebody's telling you that, let go of yes but. If you hear yes but in the back of your throat, don't say it. You might need a bit of time to go away and think about it, but that's the kind of different kind of conversation taking place, where in the end we'll all have confidence to say this isn't good enough, and conversations where users and carers are encouraged to express how they want it to be better for themselves, how you want it to be better for yourselves, and indeed for others in the future. And importantly, what the mental health measure does, it recognises that there will be times when people feel vulnerable and therefore need advocacy, can't speak for themselves, need advocacy to express what's going on for them, and that they should have an absolute right to advocacy. And I think that's a really important bottom line in the measure and becomes another part of the landscape. Just want to talk a bit about Chapter 2, and I'm now reminded it's Chapter 2, kind of from Sarah's presentation. But it's the vision in the draft strategy that's described as a new partnership with the public. If we're going to have a new partnership with the public, what people have got to experience is that they're being taken seriously. And I just ask you to think for a moment, how do you know when you're being taken seriously? Just kind of, you know, what kind of behaviour do you expect? What kind of behaviour do you see when you're being taken seriously? I think it's when somebody does something that convinces you they're genuine in what they say. Now, people do that in all kinds of different ways, but you know whether people are genuine or not. You can pick it up. Most of us can. Actions speaking louder than words. But what the words do, and I'm talking to you now, and in a way, the fact that I'm talking to you means that you have the opportunity to check out whether I'm serious, whether I am being genuine. I mean, it is the means by which you can do that checking out, and don't ignore that. There's somebody in the audience today, Dave Smith, and he's involved in some of the sessions today. And Dave was a very valuable member of the programme board that Mary and I co-chaired. And there was one occasion, sitting in a room in Bridgend, I think it was, where Dave reminded us about what being valued means. Because what he did, he looked around the table. It was a big conference table. There must have been 25 people around there, and everybody had got their name tag. Everybody's name tag had their job title with it as well. Dave had Dave Smith, service user. He explained that he was actually more than a service user, and as we all are, more than the jobs we've got and the people we are, that there are many parts to our life. And so there's some subtlety, although I think that's quite crude, what Dave kind of exposed. But there's subtlety as well in convincing people that we are that you are being taken seriously. And I think it's a kind of an interesting anecdote for me. It's one I constantly refer to. What that did, it reminded me, and some of you may know, there's a website called My Name Is Not Cancer. And actually what that website do, it reclaims people's right to be more than the medical condition that they have. And in a way, you know, you are more than the condition you've got. You're somebody with a history. You're somebody with a family. You're somebody with friends. You're somebody who may indeed still have a job and a profession and have aspirations for that. And I'm just pondering whether there should be similar websites. My Name Is Not Dementia. How many times have you heard older people referred to as the dementia patient? Yeah? Almost dangerously ruling out that they've got anything else that's important in their life now. And even, my name is not patient, nor is it service user. And when we take the risk to truly involve and listen to people who are on the receiving end of services, I think we can receive some amazing insights that can change the way we practice. And I'd just like to give you an example. About how long ago was it? It's probably 6 or 7 years when I was co-chairing the review of mental health services with Mary. Every member of the board, the programme board, was asked to meet with about 10 people who were on the receiving end of services to have a conversation with them about what worked for them, what didn't work for them, and what ideas they'd got about how things could be better. And I spoke with a woman who'd been diagnosed with depression for over 30 years. Or more accurately, she'd been prescribed medication for over 30 years for depression. The kind of medication that is prescribed for people when they're diagnosed as having depression. She went to see her GP. Her GP was on holiday for a repeat prescription, and she had to see a locum GP. The locum GP asked her a question nobody else had asked her. What are we doing to you? Really interesting question. And she was shocked when the GP is asking me, what is she doing to me? That GP took no more than 15 minutes to find a local day service and arrange for somebody to visit her to discuss it. It was actually a local mind service. She was very nervous about making the first visit, so the person who visited her agreed to call for her and accompany her. She described the first visit to that day centre as one of the best days of her life. You know why? People welcomed her. People made her feel okay about herself. And if we get that bit right, I believe lots of other things just fall into place. She could not recall any other service that she'd had in that 30 years, leaving her with that experience. So what this is about, in my view, and why I grabbed at the opportunity when Sarah offered it to share the time with her, it's about widening the circle of people who can influence the way that services are offered and provided and developed in the future. If recovery is the goal, we do have to remind ourselves that it's about much more than getting better. And that means opening doors for lots of people to get involved, who in fact we've probably not invited in. And they include housing associations, they include housing services in local councils, leisure services, adult education, including higher education. People who have had and who have mental health problems can go to university. How amazing is that? But actually, how ordinary is that? Because people with mental health problems are in this room and we're all doing amazing things together. We need to involve economic development units in local councils who are all playing a part in generating employment and training opportunities. And then all of those third sector organisations who can make things happen quickly and are not hampered. And the woman who went to see that person in her own home and agreed to go back and call for her and take her, she wasn't hampered by what I'd call the kind of demarcation lines that are often kind of placed upon us in statutory agencies that tell workers what they should and what they should not do, and often the demarcation lines tell people what they shouldn't do. Another reminder from the strategy. What it points out is that 1 in 4 of us will experience mental health problems during our lifetime. Okay? So if there are 4 of you in a line, that's 1 of you. And that 1 in 6 of us will be experiencing symptoms of mental distress at any one time. So 1 in 6 of us is going through a troubled time at the moment. So actually, it's in our interest to get this right, because it's about us. This isn't about me as the Director of Social Services saying, I think this is what we should do so that people will be okay. This is me as Stuart Greenwell saying, we've got to get this right, because it might be me. And it has been me in the past. So involving users and carers is actually about a better deal for you and me. And it is indeed another essential part of the landscape that actually we're involved in creating. We're not there yet, but I do believe that we have the tools to create a kind of fertile and healthy landscape. I hope you have a really productive and challenging day. People always say that, a challenging day. Let me tell you what I mean by a challenging day. That you'll go away from here and tomorrow you'll do something different.